Hello, I'm Dr. Ramesh Gaikwad. I'm an obstetrician and gynecologist and working as a consultant fertility specialist and laparoscopic surgeon at Cloud9 Hospital, Pimple Saudagar, Pune. So endometrium is very important part during embryo transfer procedure, and once endometrium is adequate, then only generally we go with embryo transfer, because endometrium is very important to accept or let that embryo get implanted into it. So once endometrial thickness is to mark, then only one should proceed with embryo transfer process. So how much it should be? Generally, if it is more than 9 and up to 14 millimeter, it is considered as a very good endometrium, and endometrium between 7 to 9 millimeter is also considered as a good endometrium. So this endometrial thickness above 7 or 7.5 millimeter is considered good for embryo transfer, because it will be associated with good endometrial blood flow, as well as molecular activity inside endometrium occurs very favorable for embryo implantation, and that's why embryo implantation process definitely need certain molecular changes which occurs when endometrium is up to certain thickness, as well as these androgenic factors also increases during growth of this endometrium, and this helps in embryo implantation. Since endometrial thickness is very important in embryo transfer procedure to get these embryos implanted, how we should increase this endometrial thickness before going for embryo implantation. So to increase endometrial thickness, either we go with endometrial preparation methods like going with a natural cycle, along with increasing follicular size which secretes estrogen, which will increase endometrial thickness by this endogenous estrogen, or sometimes we use this modified natural cycle where we'll prescribe some tablets to grow these follicles so that multiple follicles will grow and estrogen level will be increased, and this estrogen, endogenous estrogen, will help in increasing endometrial thickness. As well as in some cases we go with HRT cycle, and which is commonly used generally for frozen embryo transfer, and in this HRT cycle we'll give this exogenous estrogen sequentially, will increase dose so that this endometrial thickness will increase, and if this endometrium is not responding as per our thinking or as much we want, then in those cases even we can use certain other things to help in growing endometrial thickness, like certain medicines will increase blood flow to endometrium like aspirin, or certain medicines will keep this vascularity dilated so that endometrial thickness will be increased. These are mainly L-Arginine sachets, or sometimes even granulocyte colony stimulating factors like injection G-CSF also can be used in increasing endometrial thickness. Along with these medicines, or we can also use subendometrial injection of this PRP to increase endometrial thickness in certain cases. Along with endometrial thickness, there are other certain factors which are also important for embryo transfer, like vascularity of this endometrium. Along with this endometrial thickness, how is myometrium, whether myometrial lesions are there, how vascularity is there, as well as even we check for uterine artery, RI or PI in these cases before going for embryo implantation. And definitely important factor is quality of embryos, as well as embryo transfer process, how delicately we are doing these, whether it is done by some senior person in that institute, so that it should be done very delicately, and those embryos should be placed in area where exactly they should be placed.